I'm Dr. John Carrozzella from the Florida Center for Hormones and Wellness. And we're here today with Matt, and Matt has been experiencing some shoulder problems. In fact, he's been recently diagnosed as having a small rotator cuff tear, and he's in between this place where physical therapy may not be helping him as much anymore. He doesn't want to become dependent upon medicine, and he's really not ready for surgery yet. So what do? Well, there's this remarkable device that we have that's an actual new iteration of the shockwave therapy that we've had here, the GAINSWave device, for many years. It has now been improved upon and advanced upon so that it gives extensive shockwave therapy, not only to the sexual rejuvenation that we've gotten used to doing here at Florida Center for Hormones and Wellness. Now we're going to go back to our roots a little bit, and we're going to apply these shockwaves to bone and joint injuries, to tendonitis, and a lot of these aches and pains that maybe can get cleared up in a little bit of a non-traditional way so that you can avoid surgery and also possibly avoid not having to take all of those medications that can be very painful. So Matt, you've been having the shoulder problem now for how long?
Quite a while.
And you had an MRI scan that's showing a little bit of a rotator cuff tear, and you're kind of in between taking medicine and therapy and maybe having to have surgery, right?
Yep, just like you said. Yep.
Okay, well, what I'm going to do is we're going to go ahead and take a quick look at your shoulder, and we're going to find out where it bothers you. And if you tell me where the tender spots are.
Yep, you're hitting
kind
right,
of in there.
right
Yeah,
on there. Yep.
It's that usual rotator cuff spot.
Yep.
Okay, well, I know exactly where that is. So what we're going to do is we're going to have you take your shirt off,
Sure.
and we're going to go ahead and get ready, and I'm going to get the device. So we'll be right back with you, okay?
All right.
Okay, everybody, we're back and we're ready, and you can see that I can see his shoulder. And what we're looking for is the area underneath the collarbone and around underneath what we call the acromion, or the top of the shoulder bone. And we're going to hit these muscle areas, and that tender spot and that rotator cuff is in here. And it's really quite amazing what you're going to see here. In about 3 or 4 minutes, we're going to give his shoulder a full therapy session. Now, there we go. Can you hear that little clicking sound?
Sure.
Can you feel anything at all? I want you to close your eyes. Just kind of try to understand whether you feel anything at all.
Feels like a great cool massage right now.
Some people will say that they feel like a little tapping or like a mild snapping of a rubber band.
Yep.
Is that about what it is?
Yep.
Are you feeling any pain?
None at all.
Well, the really cool thing about this is this device is designed to deliver a very effective shock wave to the tissues to activate the healing response. So what that does is it actually stirs up a little bit of damage, and it causes a healing response, and it is absolutely pain-free. Now, the old device was based upon a ceramic tip that was impacted by a lead-based pellet that would go up and down. It was electromechanically driven, and it was painful and uncomfortable, and it required numbing. But this one is what's called electro-hydraulic, meaning that there's a shock-producing electrode inside, and it activates through fluid and a silicone bladder, and it mitigates that shock wave. In fact, if you look at the physics of the shock wave, it's changed dramatically. It's much faster, and it's that fast upstroke that gives the pain-free response. So it's a slower shock administration with a ceramic tip. This is a very fast shock administration so that the brain can't even perceive it as pain and discomfort. You're feeling absolutely nothing at all.
None at all.
And it is amazing because I had a gentleman in here not too long ago that we were doing a sexual rejuvenation, and the placement of the electrode got off a little bit, and he went home feeling really sore, like he had gotten kicked between his groins. So I know that the energy is getting there. The energy is there by the physics, and when you see the diagrams and you talk to the engineers, and it is absolutely demonstrated when I had a little bit of a poor placement on the electrode with that sexual rejuvenation procedure, and he went home feeling like he had been kicked. So we know that the energy is getting in there, and we do get a response. And there you have it. And with that, we've completed the treatment. He got 1,000 shocks at relatively high intensity, and you felt absolutely nothing.
Not a thing.
Okay? All right, perfect. The new shockwave therapy. Now that device is brand new. It's being rolled out to professional sports teams. And to my understanding, as of the date that we were recording this, there are only about 200 of them available in the United States. And we have one here right here in Orlando. And it's very simple. You saw it's pain-free. It's easy to administer. no more than 5 minutes, and you can get tremendous relief and find that little niche between chronic medicine and surgery and maybe get the relief. So if you're interested, we're doing free demos right now. We just give us a call and we'd be happy to schedule one for you to see if it's right for you, if it's right for your problem. Dr. John Carrozzella from the Florida Center for Hormones and Wellness.